Why the antivenoms in rabies vaccines are not as effective as old days. It is a common observation, but it is important to distinguish between effectiveness, the medicine's ability to work, and availability or implementation issues. Scientifically, these treatments are more refined today, but several factors can make them appear less effective compared to the past. Here is a breakdown of why this perception exists. 1. Snake antivenom ASV issues. In India, the effectiveness of antivenom is currently a major topic of scientific debate due to a few specific reasons. Regional variation, venom variation. Most antivenom in India is manufactured using venom from snakes in a specific region, often Tamil Nadu. However, research shows that the venom of a Russell's viper in Kerala or Maharashtra can be chemically different from one in Tamil Nadu. Because of this geographic variation, the standard antivenom may sometimes be less potent against snakes from different regions. The Big Four limitation: Indian antivenom is polyvalent, meaning it targets the Big Four cobra, saw-scaled viper, Russell's viper, and common krait. If a person is bitten by a species outside this group, like a hump-nosed pit viper, which is common in Kerala, the standard antivenom will not work at all. Vial potency. Doctors often find they need to use more vials today than they did decades ago to neutralize the same amount of venom, leading to the perception of decreased quality. 2. Rabies vaccine concerns. The modern rabies vaccine cell culture vaccine is actually far superior and safer than the old nerve tissue vaccines, the painful 14 injections around the navel. If it fails, it is usually due to Category 3 bites and immunoglobulin. For deep bites, a vaccine alone may not be enough. You may need rabies immunoglobulin RIG injected directly into the wound to provide immediate antibodies. Many people and some smaller clinics skip this step, relying only on the vaccine. By the time the vaccine triggers the body to produce antibodies 7 to 14 days, the virus may have already reached the nervous system. Incomplete dosage. The modern schedule 0, 3, 7, 28 days must be followed strictly. Missing a dose or delaying the first shot reduces the chances of survival. Cold chain maintenance. These vaccines are highly sensitive to temperature. If they aren't stored at exactly 2 degrees Celsius to 8 degrees Celsius during transport or at the local pharmacy, the protein in the vaccine breaks down and becomes ineffective. 3. Biological and environmental factors. Increased awareness and reporting. In the old days, many deaths in rural areas went unrecorded or were attributed to bad luck. Today, every case is tracked, making vaccine failures more visible in the news. Counterfeit medicines. Like any high-demand drug, there is unfortunately a global issue with substandard or counterfeit medications reaching markets, which can impact success rates. Thank you for listening. See you next time. Until then, goodbye.